A recent blood shortage reported in the country, occasioned by lack of blood bags, was an eye-opener on the need to strengthen blood banks in the country. Lack of a fully functional blood transfusion management can result in death, something that should be avoided at all costs. So are our hospitals ready to meet blood demands? Our medical reporter, DR Mercy Korir, looks at Kenya's biggest referral facility, Kenyatta National Hospital, and what it is implementing in order to meet demands for blood through what it calls the damu sasa project.
Kenya is among the many developing countries that are constantly struggling to meet blood supplies adequate for the demands by the population.
According to the WHO recommendations, each country should be able to at least collect 2% of blood from its population. If Kenya is at 47 million, then 2% of that population should actually be giving us blood.
That translates to nearly 1 million people donating blood every year, a number that remains constantly elusive since the country manages only 170,000 units, which is not even half of the minimum 1% or 500,000 Kenyans that should voluntarily donate blood. This realization led to the development of damu sasa, a software piloted at the Kenyatta National Hospital to help the facility manage its blood supplies.
I'll be able actually to know what is happening within the hospital.
Damu sasa manages the end-to-end process of blood donation, right from the donor coming in to the facility up to the donated blood being transfused to the patient in need.
And you're able to see every particular unit of blood based on how it came, who touched it, where it went within the facility.
Efficiently managing the blood units readily available is key to making sure that no blood is wasted, and that is not the only goal. Once a donor comes in, their details are well captured by the software to keep tabs with them, particularly for repeat blood donation. Paul Ocharo is one of those potential donors. His first blood donation was because his friend was in need, but after an appreciation notice, he was able to revisit the facility to donate blood once again.
I got a message from the damu sasa app. You're able to get that kind of results. For your blood group results, just sent through to the phone.
We have been able to convert replacement donors to regular donors. Related cases. What was the cost?
The blood transfusion unit manager is able to monitor the available blood units in real time and respond to plug in any gaps before they hit a crisis level.
You can set even targets of how much blood you should have in the facility based on the different blood groups and on the different blood products. So, for example, if you want to have packed red cells of A positive 10 units at any given point in time, the moment it goes below the 10 units, a notification is immediately sent.
Blood not being readily available when needed has led to many deaths and suffering. But now, Kenyatta National Hospital is moving a step closer to curing that blood deficiency.
You can use even your phone to receive a message to tell you that the blood of that patient you requested is ready. So the time you find that the time that the doctor, the clinical staff has been moving up and about looking for blood, that time is usually utilized on patient care.
The intention for us here in Kenyatta National Hospital was to get a software that could make us stop chasing after blood.
While blood transfusions save lives, many patients in need of blood do not always have timely access to it. Digital solutions that ease the chain of transfusion from the donor vein to the patient's vein may go a long way in bridging that gap to save lives. DR Mercy Korir,